In this episode on social determinants of health, we have brought together 3 experts to discuss how leveraging community, technology, and innovation can advance our efforts to solve for social determinants of health.
We've known about the impact of social determinants of health on health status for a very long time. But what's been impressive to me that we have seen a renewed interest in the last 5 years, driven by recognition that income inequality, racial inequality, access to health services, and access to food and transportation have a very big impact on the way people live and their health status.
There's great work that's established the link between social determinants and health outcomes. In the last 3 years, there's been an explosion of progress in the following areas. First, the government and healthcare systems are recognizing that this is an important problem and that they have a role to play. And so we're seeing some really innovative policy that's coming out of it. Second, the technology world has really responded. We have great platforms that are being developed by startups as well as really large established technology companies. Third, and probably most encouragingly, we're starting to see discussions between the healthcare world, the social sector world, educational systems. The more those discussions occur, obviously the more progress, because we're trying to break down the barriers between these silos and surround the patient with opportunities to address social determinants.
We have a growing body of knowledge in general about how the needs of individuals extend well beyond what their clinical profile shows us, and how much where you live, who you live with, what you do every day, where you find joy in your life really impacts your health. On top of that, we also have increasing data capabilities that allow us to understand at that greater population or community level how changes in economic profiles or in community assets really impact health for the entire community, including at the individual level of the folks who live there.
We need to be better coordinated with existing state and local government and private sector, nonprofit, faith-based organizations, bring together those resources in a more systematic way, with a focus on trying to improve health equity in the broadest sense of the word, and channel resources to redressing upstream some of the issues that cause the inequities that we see in the health system. Well, as we look forward in terms of implementing social determinants of health, there are a number of challenges ahead. Having the tools and capabilities to really produce meaningful change in communities. And by tools and capabilities, I mean the kind of analytic framework, the data, and the institutional apparatus to be able to implement initiatives in terms of social determinant.
Another key challenge that we face is truly seeing the world, the issues, and the solutions through the eyes of the individuals that we are seeking to serve, and making sure that as we're designing and redesigning and reimagining our delivery system, that we're doing it with our patients and with our community, so that in the end, we will meet their needs in more meaningful ways.
I think the greatest remaining impediment is really a payment problem, which is how do we make sure that the payment system that incentivizes all the various stakeholders, health systems, housing organizations, food banks, everyone that's working on this problem, that they're sharing in the success that we have. And for example, imagine a health system is working on reducing rehospitalization or readmissions for patients, and they partner with a housing organization, and that housing organization helps the health system identify housing and succeeds in that, and thereby reducing readmissions in that patient population. The hospital benefits because they're no longer getting penalized by the readmissions. Is there a way that the housing organizations could also be partake in that. And if we were able to solve that with higher level payment systems, I think we'd see tremendous progress. It's really an exciting time to be working on this because of this technology. So one of the things that's occurring is using AI or natural language processing systems to go back and read doctors' notes from the past. We collect a lot of information about patients over time. It's rich with information that identifies these social determinants. So using technology like natural language processing to identify them and bring that to the bedside when decisions are being made. The second is to be able to make predictions. When we start combining clinical information with information on social determinants of health, our predictions about what might happen to a patient are much more accurate.
I think we're seeing some great examples of this across the country with regard to hospitals and health systems putting in place population health registries, using data analytics to identify which patients have particular deficiencies in their social determinants patterns, and using that to coordinate with other institutions in the community. And I think this is an encouraging and positive part of the story of social determinants of health.
Or let's imagine a person's an outpatient with chronic kidney disease, the kidney disease is progressing. There's certain clinical functions that are progressing the clinical disease, but the provider wasn't aware that these two social determinants, lack of access to food, a lack of a social network to support the patient, is going to progress their chronic kidney disease. So multiple ways that AI systems can predict and help define the problem for the provider so that they can make the right decisions.
Well, there's a number of areas where I think increased focus is starting to make real differences. And I'm thinking particularly of people like ProMedica in Toledo, Ohio, to be much more rigorous in screening all of their patients on a routine basis for food insecurity and other social determinant factors, and allowing them to intervene in very concrete ways in the lives of folk to provide access to healthy food, much in the way that they would provide access to healthy medicines.
There are different ways that healthcare systems are thinking about partnering. One way to partner differently is to look at internally at our own silos and continue to take down the traditional structures of care delivery and work across service lines, across facilities to better organize and coordinate care. Payers are an important partner in the equation, not just because they provide the necessary funding for healthcare delivery, also because they bring clinical information, resources, and data that can help fuel better coordinated care for patients.
Two things immediately that resource-strained organizations can do. One, tie these social determinants of health initiatives to core health system operational issues like reducing length of stay or reducing rehospitalization or readmissions. Easy win and can immediately be employed. Second, use cutting edge technologies to save a lot of work for your staff. Use natural language processing, artificial intelligence, read the notes, find the information, prevents your staff from having to do laborious manual screening, focusing on the efforts that are most important for them to focus on with the patient.
Hospitals and health systems can be so-called anchor institutions for their community because they are often the largest employer, and they are capable of using their financial heft to redress many of the economic wrongs of a community. But they can't take all of that responsibility on, and certainly can't load on their balance sheet income redistribution and housing and everything else. What they can do, in my view, is to be beacons of quality and hope for the institutions surrounding them and for the communities surrounding them, so they can galvanize action, they can reach out and coordinate with other institutions and other players to really shift the community towards a more positive future.